Welcome to 40 Below Zero, an international podcast about life with invisible illnesses, hosted by two guys living with multiple sclerosis. Coming to you from the Keystone State of Pennsylvania, I'm your co-host Nix, and with me on this ride is Terry, a Londoner who calls Ontario home. We're so happy you're here with us as we continue to try and normalize a life that is anything but. So let's get into it. Welcome back to the show, Warriors. We're so glad you're here today. We're always happy to see you. Terry, we got a lot to get into today, man. This is going to be a show.
Yes, we do. I got a lot to say too.
All right, rock, paper, scissors. Who's going first? Ready?
Let's go.
1, 2, 3, shoot. Oh, you cheated. What'd you throw? Scissors?
What are you
All right,
talking
we
about?
tied.
Scissors.
All right, let's do it again.
Are we
Ready?
really doing this? Okay, on
Yeah.
three. Okay.
Yeah, we're really doing this on
All right,
three.
Okay, go.
1, 2, 3, shoot. Oh, he's so slow. All right, you beat me. Rock, you win. Go first.
You sure? Okay.
Yeah, I'm sure you won, fair and square.
Last time we talked to Sean. Remember Sean? And he said
Mhm.
that he was on Archivist and he had sunburn
Right.
stuff. Yeah, I you can't see it now because I put cream on and stuff like that. But I've noticed I have a lot of patches, and it looks like sunburns. It kind of looks like eczema. So I'm like, oh, I'm getting eczema, but it's not. It's a side effect from Archivist. So
Oh.
yeah, and I wouldn't have known that unless he said that on here.
Well, definitely keep an eye on it. I would recommend taking a photo. I mean, a photo. God, how old am I? Taking a picture with your phone,
Yeah,
and
but
so that way you can see if it changes over time. Because if it's just there and then it goes away, then it's
it,
no
it was
big.
a
But
lot worse. Oh yeah,
okay.
yeah. Thanks though, thanks. And also a lot of bumps on my forehead, like almost like it's getting acne, but it's not.
Huh.
So yeah. So that's my 2 cents on Archivist. But yo, I
What
wouldn't have
else?
known if Sean didn't say anything. Right? I would have
No,
just been like, oh, it must have been the chocolate I ate.
hey, you never know.
Yeah. So other than that, I had somebody come in to do some cleaning in my home. The first time ever
Yep.
I grabbed, I'm still not comfortable with it. Why? Because he doesn't do as good a job as me. I know you're going to say, nah. And he's a nice guy, but he just doesn't do as, and what am I supposed to say to him next time he comes, which is next Saturday? Should I say, hey,
I
man, I need you to actually clean the sink? I had a spit mark on my sink that I was
yeah.
like, yo, my spit mark is still there. You're like, why is there a spit?
No, I get it. I don't know. I've never had anyone come in and clean my house, but I would imagine honesty is the best policy. And if he can't handle it, he can leave, I guess. I don't know. If he's a professional who will take your constructive criticism.
I He's more of an assistance. I don't think he's a guy who's gonna come in and do the job I want.
Oh,
He's
so
like
he's not a
assisting.
professional cleaner. Okay,
No,
he's
because
helping.
he came in and he said, I'm not a PSW. I'm like, I never asked for a PSW. This company is
Gotcha.
supposed to bring someone to help clean around whatever I need help with, laundry. But he came in and goes, I'm not a PSW. I'm like, why did you have to say that? I'm not going to ask you to pull
Just
out my
letting you know right
catheter.
away.
Yes. So, and then he came in and he goes, so I'm coming on Tuesdays and Saturdays. I'm like, whoa. I talked to your boss, I guess, and I told him 1 day a week, 2 hours, because this guy's like 3 hours Tuesday and Saturday. You see this, and then yeah, you know what?
The
I'm
stuff. You're
gonna
getting
start
fired up
looking
on it.
into yeah, dude, this is my direct funding. Now that's looking good. I might look into
Yeah.
that.
Okay.
Yeah. Yeah. So, and my finger is still busted. Do you remember that? I told you that.
Yeah, you stubbed your toe.
Yeah.
Are you ready for my tear?
Sure, we'll go yours and then we'll come back to me.
Oh, you're not done? You got more?
No,
All right.
no, dude. Dude, no, I'm good. I'm good. Go ahead. I want to hear your stuff.
Okay. Well, it was kind of a really sad day today. In the context of I'm fine, but those who live around me, or I don't even maybe have seen it on the news, um, the health system in my area closed. So that is One, two, three, four hospitals have closed in my county. The last two just closed. Well, so it's the Crozier Keystone Health Network. And the latest two hospitals to close down were Taylor Hospital, which is about like, I don't know, maybe 10 miles from me. But then there's Crozier Hospital in the city of uh Chester, right on the border of Upland Borough and Chester City. Um, that was kind of in limbo. Everyone was holding out hope that the buyers of the health network would come in and save the day, but for whatever reason, they didn't wait any longer, and they shut down those two hospitals and they closed the health network. So, uh, local news channels were reporting 2,650 some ish employees were let go. Today, the reason why it was sad today, personally, was because it was the final uh, therapy session for my daughter.
Okay.
Because there was rumors that they were going to keep there was rumors that they were going to keep the whole system open, and until somebody would come in and purchase it and take over. Then that turned out not to be true. Then they said that they were going to maintain services while they filed for bankruptcy, and that turned out not to be true. And then one day, like 2 weeks ago, they just sent out an email to everybody saying we're closing in 30 days, which would have been the end of May. And then a week later, everyone got another email saying today's your last day. So we had, like I said, the last meeting with my daughter's therapist today. And let me tell you, this is a big hit, dude. This is big because you're talking the entire county has like one hospital now, which doesn't sound like a big deal until you figure that there's a lot of people that live in this county. And
So
we're
why is it only on the local news?
I don't know. I don't know, but it is definitely for those of us that live here and around here, it's a crisis. I mean, you're talking employees of the system who have had their entire careers there. So you're talking people that I know personally that have been working for the system for over 20 years. Um, you're talking about mental health services. You're talking about a level 2 trauma center is closed now. You're talking about uh, one of the nationally ranked top tier burn units is now, shut down. I mean, not even to talk about the over 2,000 families that are impacted as far as employment goes, but you're talking about the hundreds of thousands of families that are impacted because now they don't have access to these hospitals. No emergency rooms, no mental health services, none of it. It all just went away. And today was really sad because when my daughter and I were in there, you see all these patients coming in and out, dozens of people in and out in the half an hour that we were there. And you just see their faces and you're just like, they just look so defeated and scared because literally what they were telling us was they handed us an envelope with my daughter's medical records in it.
No.
They handed and on top of that was a sheet of paper
Yeah.
for alternative care providers. And there was a letter saying that her doctor would write a 90-day prescription for any of her medicines. So every patient is receiving a 90 days of anything they want. And then that's it. So what my daughter deals with is very serious, and it's very much impacts her and how she moves through her day. And change is not easy for her. Change is probably one of the worst things for her, on big sweeping changes like that. But then I start thinking about people that I've seen in this building who require like hour by hour care.
Yeah.
And now they're in the wind. So it's crazy down here because, you're talking about what in an emergency situation, you suffer an emergency. I'm not saying, take it out of the context of maintenance care, like what I'm talking about with my daughter, but in an emergency setting, you get into a vehicle accident or you have a stroke or whatever, something that requires immediate attention. You've now gone from 5 to 15 minutes away from a hospital to now we are like pretty much the rest of the world where it's like you're half an hour to an hour away from the hospital. And that hospital is packed with everyone else who's from the same region you're from.
Yeah.
It's just crazy. It's just crazy. Like to me, I don't even know how it's legal. Like I
D-
understand that the health system is a business and they're going to run it like a business regardless of how many people suffer from their decision making process. But like it just surprises me. I don't know. I'm going to say it like this. I'm just surprised that there's no adults in the room. Where are the adults? You know what I mean? It's like we're letting this happen. So let's see, Crozier, Taylor,
Dude, you were talking about
Delco.
this last week that
Yeah,
I didn't think it was going to actually close. I thought somebody was going to step in. Dude,
right.
where is Elon Musk? Why did they spend so much money sending people to this space for 10 minutes? Dude, like I have no words for you, man. That sucks. I'm really sorry. I hope
So
I don't know
now
how it's
that
going to turn around. Like what's
oh,
going to
dude,
happen?
we are down to as one hospital in the county, and I don't know the population of the whole county offhand, but I know it's a lot of people. Um, I'm gonna try to check it out
Dude,
real quick.
you said it. Like, what if you get a stroke? What if you have a seizure?
Right.
You got minutes. That's crazy, man.
As of 2023, the population of my county was 576,000 people
Okay.
for
Yeah.
one hospital now.
Did
That's a
did
long
you
wait time.
did was were you and your daughter aware that that was going to be the last session with the
No,
therapist?
a week ago, we all knew it was closing, but the
Yeah.
understanding was that there was going to be a 30-day period to give everybody some time to get their next, you know, phase in order. But then the hammer dropped and it went down to a week.
Eh.
So I don't know. It's just
Dude, if you're angry, I'm sure there's so many people
there
just
is there's people. I mean, the the Facebook communities are on fire. The town meetings are on fire. The county meeting is on fire. It's just, there's only a select few people that you can get mad at because you're talking about a company run by a board that oversees the entire health system. So hopefully what happens is either one of the big networks from Philly or Delaware kind of come in and cherry pick which hospitals they want to reopen under their, because I was even talking to the therapist and I said, well, you have to, it's not like you're going to be back in your job if somebody buys the building because you're going to have to reapply for that new health system and hope they hire you.
hmm,
I mean, which is crazy.
I feel like it's turning into a third world country.
I mean, if you think about it, it's not great.
I got no words, man.
Yeah, it's just very frustrating. It's so we're looking into the alternative list that they gave us, but the problem is so is everybody else. You know, they only give you a list of three or four names. So, and it's not like I can say, oh, well, that's just, it's just because you're used to having so many choices and so many options.
That's
Yes,
garbage, man.
yes, we were used to having choices and options because there's 500,000 of us in the county.
Dude, there's standards.
Right. So now,
Say, man.
but yeah, so because I was in the business, so to speak, so because I was part of that for a little while, um, I know people, so I see their Facebooks, I see them crying because you're talking about guys and gals that were supposed to retire, you know, just it's crazy, dude. It's crazy.
And it's just today, right? Today's
What's
official.
well, it was official last week.
Okay.
On
Okay.
Friday, they let everybody know.
Okay.
Again, then again, it was Friday. The news broke. I think Thursday or Friday. So it was like,
I'm not really a mainstream media guy anymore, like CNN and all that stuff.
right.
But is it on there?
I don't know. I don't know. It could be, but I mean, because you're talking about a whole. But then again, I don't know. This might have happened elsewhere. That's why, like, so what I tell people is because you and I talk to people all over the world, I kind of say things like, well, yeah, that's kind of how it is in other parts of the world. You don't get to just walk into the hospital and expect red carpet treatment or, you know, sometimes there's not a hospital near you. And sometimes, so now it's like, I got to drive.
But that's not the same, man, because you have 10 hospitals going down to one.
Yeah.
That's not the same as like, oh, not, it's like you guys were spoiled. Now feel the way it is when you live in Antarctica. Do they even have
Right.
hospitals there? I don't
They have to. There's people there. There's probably
know.
one.
But they might have like Dr. Nick who's there for their tribe. Is there
Yeah.
tribes? I don't know.
Yeah, bro. I don't know. Yeah, the penguins, the tribes of the penguins. So yeah, it's very frustrating. It's actually scary because now what really gets scary is that people in the area now know that if they go to the one hospital that's left, they're going to wait a very long time to be seen. So that's going to deter people from going to the hospital because they will start to look at everything that happens to them and go, it's not that bad. I'm not going to sit in that hospital waiting room for 10 hours just to be told to come back home and take a Tylenol. So they're going to delay, people are going to delay their own care.
Fractures will be waiting there for like 12 hours, 15 hours, whatever the case is, maybe even longer. And
Yeah.
for the most part, you're right. They're going to be like, it'll heal. And then
Yep.
it heals the wrong way. And then they got to come
Yep.
back. And
Yep.
yeah,
Or, oh, it's just a cough. And then it's COVID.
it's long COVID.
You know what I mean? Like,
Yeah, man, I hear you.
so I don't know.
Tough.
It's just very, very scary. And
It's
it's
a
just,
fail.
yeah, it really is. And I know that it seems like when we talk to our people from overseas and we hear about national health systems or even with you, with the government runs some of the stuff. Like, I don't know, is that any better? I have no idea. I mean, shit, the way our government runs, probably not. I don't know.
You hear good things and bad things from both sides,
Sure,
right?
sure.
Like,
Uh, So I don't know. It's just scary because my where I go to get my infusions was at
yeah.
Crozier. So now I got to find a new
Oh,
infusion place.
damn. Everything
Um,
is inconvenience now.
yeah. Well, it's okay for me to be inconvenienced, but like maybe give me the option to have an at-home nurse come and give me my Ocrevus at this point, so I don't have to drive, 3 hours away to get my infusion. So we're seeing all these little, I don't want to call them pop-ups, but these little very specific service offices open up. So like there's an imaging place where all the MRIs and CAT scans get done. And then now there's another place that like all these little for-profit urgent cares are propping up. So they're like, oh, if you have, a cough or a scrape or whatever, come to ours. But again, you're just going to another company. It's not a
Yeah.
health system. They're not connected to your, so it's
Yeah.
we're kind of finding ourselves now in a health desert, sort of. I mean, we still have care in hospitals and stuff, but it's definitely not what it was. Dude, it was crazy because when we were going to the appointment today, we were driving past the emergency room at Crozier, and normally you see ambulances backed in because it's a very busy hospital. Today there was one ambulance and four personal cars. Like people were there, like cleaning out their offices, so they just backed into the ambulance bays because I can show you um, the alert that went out across the paging net, the paging system to the fire service. Big page that said like effective immediately, Crozier and Taylor Hospital emergency departments are closed permanently. Make alternative plans to transport to other facilities. It's like then then within 48 hours, there's four shootings.
Oh, dude.
Yeah.
I'm not.
So it's like, so now those incidents occur, and where those incidents were would have been a 3-minute ride to Crozier Hospital. Now, half an hour to Philly.
Do you guys have helipads and stuff?
Yeah, but it's closed. The helipad's connected to the closed hospital.
Well, I might
Yeah.
be heading down to your area to be Dr. Terry. I'm not joking about it. I'm sorry.
But yeah, it's unbelievable the things that, and that's, the 2,600 people that got let go. I don't know if that number even counts the contractor staff. So like I don't know if the janitorial services work for the hospital, or if the cafeteria service works for the hospital, or the valet at the parking garage works for the hospital. So if they don't, they also lost their job too because the place that they were working closed down. So that
Yeah.
number might even be higher. I don't know. I mean, I could be wrong, but
Dude, how is this not mainstream news? Like,
first of all, how is this legal?
uh,
How do you just wake up one day and say, well, we're closing 5
nah,
hospitals
that's crazy.
within a 25-mile radius? I don't know. Yeah, it beats me, man.
So, do you guys have backup already? Do you guys?
Yeah, we've been planning. We made the phone call to some of the people that are on the list. So we'll see if we can get in there. I got a phone call into my neurologist to see where else I can go to get my infusion. I even asked him if like I said, I could have an in-home nurse come and take care of it because it's just, I don't know. So what I one thing that I do want to highlight is the importance of keeping your records every time you go to the doctor. Um, because we looked through the packet of records that my daughter was given today, and it matched what we had because we had already been, every time she came home, we had been putting it aside. So because it's important, because when you have a whole health system closed down, you might not have access to your records. So I just backed up all my stuff again on the computer. I scanned it
But
in.
people don't. People don't think like that. Like, what if my hospital closes down?
Right.
Right?
You don't expect it to
That's
happen.
crazy.
So yeah, I took the time earlier after her appointment and before this. I made sure to scan. Like I had about a dozen or so pieces of paper that I've kind of been like putting off. Like, "Oh, I'll get to it." Nope, they went right in the scanner today. And yeah, it's important. You got to make sure you have your own medical records because You don't know. No one in this area thought that this system would ever shut down.
Not 5 hospitals. I know of hospitals closing down, but
Yeah. So here's a crazy little tidbit too. You
yeah,
want to talk about not expecting a hospital to close? One of the buildings on Crozier's campus, which
yeah.
they called old, like they referred to it as Old Crozier or Old Main, like that kind of a. It's the oldest building on the campus. It was the original location for the hospital when the hospital was like smaller.
Okay.
Talking decades ago. Um, Dr. Martin Luther King Jr.
Yeah.
graduated from the Crozier Theological Seminary. Well, the Crozier Theological Seminary is one of the buildings at Crozier Hospital. So the location where Dr. Martin Luther King Jr. studied theology is now that building is now closed. You'd think somebody might have stepped in to save that one.
I no words. I'm gonna say something that's gonna piss people off. Where's Elon?
Yeah, seriously, if he can give people $1 million to vote,
You know me. If you fire me up, man, I won't stop.
well, that's kind of the point. Let's
I
fire
really.
Terry up. It's just ridiculous, is what it is, because it just continually highlights the fact that you should never.
How is sick people not a priority?
Exactly.
Do you have sick kids hospital that's closed down?
No, that's no. We have two of those. One is called Children's Hospital of Pennsylvania, or CHOP. That's in Philly. That's alive and doing well. That's great. And then the other one's called AI DuPont, which is in Delaware, and they do a phenomenal job too. So,
Good.
but yeah, it's hard to even imagine. And you drive past the buildings, and it's like, you see the number of cars that are there, and you realize that's the number of employees that are there cleaning out their desks. There are no patients.
And there's a lot of transfers, right? Like they're going
Oh yeah, they have to
because
get
people are.
yep, they got to find beds for all them people that are there.
So basically, you're not priority. You're not priority. We
Yep.
gotta unplug you for a bit. This guy, no, but like
No, yeah, it's terrible. I laugh because it's crazy to even think about.
if you're
So,
listening and you got the money, please help them.
so it is my hope that very soon some of the other health systems step in and start buying up parts of the company and then reopening hospitals, within the next 60 days. Because there's definitely a lot of healthcare workers out there that have been putting their heart and soul into the Crozier Keystone Health System for a long number of years.
How do you spell Crozier? KR?
No,
Okay.
Crozer.
Okay.
Um, yeah, there's a lot of great people that work there. Like I said, top tier burn and trauma centers. And, all the way down to the rookie floor nurses, that just started like a month ago. So, so yeah, that's what's going on. Fired me up, believe me.
Let's take a breather.
um,
Don't joke, bro. I love vibrations like that. Okay.
yeah, so Tara, that's it, man. I don't know what to do except for what I'm doing. I'm just hoping for the best and hope these hospitals come back online soon. Um, and just, stay safe
Yeah.
out there, I guess.
Dude, something's gonna happen.
Oh, it
Something's
will.
gonna happen.
It will. Well, we hope.
Keep me updated, bro.
I will.
So I have two good news
Well,
just
yeah,
to
let's
throw
go
it
to
out
good
there.
news. Yeah, we could use
Um,
some good news.
men's support group finally happening, man. Yeah, it's happening. So I'm really excited, man. It's happening really soon. We're
Good.
hoping by July it'll happen.
Oh, that is quick. Yeah.
So, and it's going to be national. So
That's awesome,
please, you
dude.
must attend at least once every 4 years.
Me?
Yes, you.
Yeah, I'll be there.
Okay,
I'll be there
cool.
in day one.
Okay,
If I
okay,
don't get an invite, we can't be friends anymore.
okay, cool. Another thing happening is there's a program called End MS Sprints
Okay.
program. This is a national training program in Canada focused on MS
Right.
research.
Okay. Ugh, thank
And
goodness someone's focusing on research, Terry.
it's
Somebody has
really
to
cool.
do it. We
Are you
appreciate
being
your
funny?
effort.
Oh, you're being serious.
No, I'm
Okay.
being
Cool,
serious
cool,
because of the
cool.
funding issues that I was talking about a couple
Oh,
episodes
yeah,
ago.
yeah. Oh,
Yeah,
yeah.
it's getting bad.
So it's huge. This is huge. It's a huge
Yeah,
program. And they're involving me somehow. I'll keep you up to date with that.
good.
But
Big
I'm
things on
excited.
the horizon.
In middle of May, I'll be attending one of their lectures and talking with them. So yeah, so that's cool.
That is cool. I'm very happy for you.
Thanks, man. Appreciate it. Yeah. Give me some good news, man. Something
Ugh.
that and then we can let everybody go on a
Well, the
happy
weather's
note.
nice. The weather's nice. School's almost out for the summer. I don't know. I'm not. I haven't been in school, and I can't even tell you how long. Well,
Yo, you look
the good news is that you look good. We're
no,
still
bro.
here
I was just
chatting.
about to say the same thing. You look good
Ah, I
in
beat
red,
you to
bro.
it.
You look good in red.
We match. We're matching again.
Why is that badge still on your wall? I thought you were gonna send it to me. Yeah, bro.
Well, you come down, maybe I'll give it to
Thanks. Appreciate it.
you. So that's what we got for you today, everybody. I'm glad. Sorry, it was kind of a downer episode, but that's really what's happening. I wish it could always be, hey, this is, I wish we could get on here every week and say that there is another breakthrough in the treatment and, you know, for the disease and all that stuff. But, and I gotta say, I curbed a lot of the political stuff that I could have gone into as far as the healthcare system and all that. I really just wanted to focus on the patients that are impacted and the healthcare workers that are impacted too and their families and all that. So I wanted to focus on that. So
That's cool because I didn't even mention like how
yeah,
did politics affect that. I just
yeah,
let it go.
yeah. Well, typically what happens when you have a major so the last time we had a major thing happen in the area, there was one of the biggest employers and one of the biggest energy suppliers for the country shut down. And in my town specifically, there were hundreds of families that were employed there. So it was a really, really, really hard blow to the town for a little while. But then for about a month or two. But then a big name politician stepped in because he needed a win. He brokered the deal and it opened back up. So I was kind of hoping that being always being an election year, that a
Yeah.
politician from the state level would step in and say, hey, or maybe the governor, or maybe, I don't know, maybe someone at the federal level, but they didn't, or they haven't yet.
It's
So
not over yet. Yeah,
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 I'm very hopeful that
yeah.
Friday is the day that they're closing the doors. So I'm hoping that Thursday afternoon, somebody was like, hey, by the way, we're going to stay open. I brokered a deal to stay open until they find a buyer. So, we'll see. Let's hope
I'm
that's the
gonna check
case.
the
But
news after
yeah.
today. I'm gonna be all over
So
that.
if you want to search, just search
I'll
Philly.
find it. I'll find it.
Yeah.
No big deal.
Delaware County, PA. So, Terry, that's what I got for you today. And so we'll talk soon, brother.
Yeah, man. We'll talk soon, bro. So check us out at 40belowzero.com. That's 4 below zero.com. Or feel free to reach out to us. We'd love to hear from you. Our email address is info@40belowzero.com. Our personal Instagram account are for Nix, it's Nix_V713. Or for Terry, it's What's _MS. Awesome. Looking forward to hearing from you guys. We'll talk soon.